Hi, today it's April 27, 2022. I would like to greet everyone. And again, my name is Yanick Dantiste. I am a family nurse practitioner who based in West Palm Beach, Florida. Um, the educational topic for today will be, like we see in that picture, what are the disorders of the mind and emotions? It's always good that people we know, um, you know, the category. So if somebody have something, you know exactly what system is affected. So we are going to. I'm just going to give you a brief um, teaching about knowledge about, or we can say I'm going to share some knowledge about what are those disorders, what are those diseases or illnesses of the mind, of emotion. As usual, before we start, let's see what God said about healing. If we go to Psalm 6, verse 2 to 3, uh, the word of God said, quote, "Have mercy on me, O Lord, for I am weak. O Lord, heal me, for my bones are troubled. My soul also is greatly troubled. But you, O Lord, how long?" As we know, we are not only physical, we are body, soul, mind, physical, and spirit. So that's why it's always good for me to start with the spiritual aspect um, of the body. So always go to God word to see what God said about healing, about sicknesses, and etc. Um, so what are the disorders of the mind? So let's and emotions. So those disorders, okay, they are addictions, obsessions, and compulsion. So somebody said, okay, I am OCD, like I am obsessive compulsive. So this is a disorder of the mind and emotions. Phobias. So people who has fear. Somebody they have um, fears of the dark, fears of, like, somebody, even though they need an and they need to do an MRI, the testing, they cannot do it because they are claustrophobia. They cannot stay in the small uh place dark. So that's phobia. Somebody they have phobia of snakes. Even though you just tell them about the name of snake, they can pass out. So you have to be careful. And sometimes also it's a spider. So we have different type of phobia people has. Everybody is different. Somebody, I know somebody, she was, at that time she was like, in the 50s, and she never uh take airplane. She has phobia of airplane. She said, me never, I prefer to die than to use airplane. So it's extreme fear. And depression, it's part of the disorder of mind and emotion. Stress is also disorder of mind and emotions, and anxiety, insecurity, um, uh, memory loss, and insomnia. Of course, there's more than that, but the main one, they are the one we just stated. So Let's talk about epidemiology, some data about addictions. So, um, when we talk about addiction, we are talking about the drugs with potential for misuse. Okay, so that's when we are talking about addiction, about regarding drugs. So those drugs, they are narcotics, including morphine, opium, heroin, and methadone. And also we have the drugs who's not for uh, directly for pain, for acute pain. We have also antidepressant, the depressant drugs, also like alcohol, the barbiturate, um, med- those medication for anxiety, and sedative medication for sleep. And also we found those the stimulants such as cocaine, amphetamines, hallucinogenic drugs, and of course marijuana. They are those drugs that with potential misuse, so people can become addicted with those drugs. Nicotine and caffeine can also be abused. Also, we have anabolic steroid. You know, especially people in sport, they use that to have big muscles. And human growth uh, hormone are often misused as well by athletes and bodybuilders. They are seeking, they just wanted to increase their muscles mass, so that's why they use them. And also, true physical addiction is known to occur when the narcotic and depressant physical psychological dependence with or without physical symptom. So that can develop from using many other prescription drugs such as tranquilizers. So it's a mixture, So that's why we always said, you know, the if you read from about addiction, is always fatal when people they are using drugs and they mix it with alcohol, with sedative, and many medication. So um, when so many drugs together, it's a recipe for disaster like death. um, al- Alcoholism and alcohol abuse in the USA costs approximately 98 billion, not million, billions dollars per year. So it's a very costly disease. And also it costs, okay? People die from alcoholism or alcohol abuse. People die from that. We have like 100,000 lives each year we lost because of that kind of abuse. Only addictions, from alcoholism or alcohol use. Also, according to research, 50 to 80% of all alcoholics have a close relative who has one. I mean, who is alcoholic as well. So, some research, they said is might have a genetic component to be an alcoholic. So they are trying to find, if there's a gene, maybe there's a gene who is responsible, but they're still researching. And also one half of all traffic fatalities and one third of all traffic injuries, they are related to alcohol abuse or alcohol use. So this is a very significant healthcare problem. So, and also one third of all suicide and one third of all mental health disorders are estimated to be associated with serious alcohol abuse. So that's why it's very discouraging for people who already has a mental issue, like depression, anxiety, to use alcohol. We always, encourage them not to drink. I mean, the drinking issue, it would be good for everybody if we don't drink, or whoever want to drink, but do it in moderations. But especially people with mental issues, um, combination with alcohol with their mental issue, it's not a good thing. Okay, so they should avoid it. uh, Caution about addiction. Addiction to physical substances should always be treated by a registered practitioner who is specialized in substance abuse. So it's not everybody who can treat that disorder, because this is a very specialized disorder. And sometimes they need combination of medication to help that, and sometimes they need session group therapy. They need a different facet of health care to treat that condition. So this is a cautious, the addiction, people should really go to a registered practitioner who really experienced to treat that disorder. And also, a big no, this is a big no. Whoever has prescription drugs for addiction, they cannot, whoever have prescription for addiction, please do not discontinue any prescription drugs unless you are under supervision of your practitioner. This is a big no, because uh, this is a big no. In order for you to become, even though when you're starting to take the medication, you feel good, you feel better, it's because of the medication. That's why I kept telling um you know my patient, or some people who ask me for advice. They told me that, um, for example, I know somebody who called me and told me that, oh, my son used to be on those medication for addiction, because with drinking and marijuana or whatever. So she told me that, well, I told him to stop it. I don't want him to take it no more because he's doing well. I said, no, do not stop it. You need to call your practitioner to make him aware. You cannot stop medication like that, especially psych medication, because you're going to create a monster in your hand by doing that. So, and by the way, it's any medication. People cannot stop it by yourself. You cannot decide it. Like, I have high blood pressure personally. Like I said before, nobody has 100% bill of health. Okay, everybody trying to do the best to be healthy, to have the optimal health, but no one has 100% bill of health, excellent health. That's what I mean. So like me, I have hypertension. I am on amlodipine, and even though my pressure is well controlled, sometimes my pressure is 110 over what, 60, 70. I'm not stopping it, because the reason it's controlled is because I'm taking my medication every day. Even though I take some alternative medicine for my blood pressure, which is garlic, parsley. Um, I'm taking that, and I try to eat low salt diet. I try to exercise, but that all those things, all those components help to control my blood pressure. It's not for that reason I said, oh, I'm going to stop my medication. No, because this is a recipe for disaster if somebody's trying. So with addiction, it's the same thing. Whatever you need to do, contact your practitioner, and especially somebody who's really experienced in substance abuses. So, in order to do the right thing. What are the symptoms of addiction? So you can have someone can have loss of control over the drugs. It's when somebody have has loss of control over the drug or the substance. It can be any substance. It can be Xanax. It can be um, tramadol. It can be the big, the pills now everybody trying to talk about, oxycodone, alcohol. If you don't have control over those drugs, you can become addicted, especially if they have that potential to be addicted. The medication has the potential to be addictive. Um, One of the symptoms also is mood swings and irrational behavior. That's mood and irrational behavior. The other symptom is sore or red eye with dilated or constricted pupils. In order to see that symptom, people the healthcare professional, they needs to examine the eye, or the eye doctor. So we can easy, once we shine a light, a pupil light, we can see if the pupil it's constricted or dilated. This is one of the sign. Also, we can we the addicted, the patient who have an addiction can have irregular breathing. The breathing is not regular, so we can see that itchy or running nose, especially those one who's using, cocaine, nausea and vomiting. And also they can have a drug withdrawal symptom, which can include craving, depression, restlessness. So they cannot, they are restless. They cannot rest. Yawning, sweating. This is a sign of drugs withdrawal. Abdominal pain, vomiting, diarrhea, loss of appetite, and suffering from goose flesh. So this is all the symptom of drug withdrawal. So so as I said before, so the two main caution we have to we in an addiction people have to remember is uh, addiction to physical substance should always be treated by a registered practitioner. I know where we live in South Florida. There's few people went to jail because they are trying to run some business, for addiction to treat people, and they didn't have license. So just be careful. Make sure they have their license. You can ask them, let them show you they have their license. They should post it. This is the Florida law. If you have a business, you need to post your license so everybody can see it. And also, never discontinue any prescription drugs. Regardless, it was for addiction, but because we are talking about addiction today on that video, so it's prescription about addiction for now. So never stop it unless you are under supervision by your practitioner. This is a must. All right. So hopefully that little teaching has helped you to know more knowledge about addiction. And yeah, so and also we cannot also forget also about smoking. Smoking is is this is a type also of addiction. We have the alcohol, we have the narcotics, and smoking also is one. um so especially the smoking, the relaxation smoker feel is because tobacco contain nicotine, um which is the addicted alkaloid. A number of diseases have been directly linked to smoking. Okay, beside you being addicted to smoking, so there's a number of diseases can caused by smoking, such as what? Such as cancer, lung cancer, bladder cancer, um, you name it. They can cause by smoking. So we have to be very, very, we have to be very, very cautious what we do, because we only have one health. So we have to care about your health. And that's why I'm really focused to give, information about health. Whatever I found, whatever I have, I will always share that with you guys so you can keep it, you can have it, because more informed we have is more informed decision we will make. So on that, I will wish you guys. I'm going to stop now, and I'm wishing you the best of health. Bye bye.